It will save us money. It will help our fellow Americans and fellow Pennsylvanians. But ultimately, because this would be put in place, we will actually save money and also not have to worry about extra tax increases. So you may not necessarily see an immediate savings, or you may not see where it actually has anything to do with you. But if you own a home in Pennsylvania, ultimately your taxes are going to be increased, most likely. But if we start covering fellow Pennsylvanians, it could nullify the tax increases. So we want this to go through. Now, I don't know all the provisions in the bill. It may be a good bill. It may be a so-so bill. It may even be a bad bill. We don't know. But if we make sure that we learn about it, then we will know. But the thing is, even if it's a so-so bill or even possibly a bad bill, we need to still support it. Now you may wonder why. The answer is, no matter what kind of a bill it is, it's still ultimately going to save us millions of dollars. It's still ultimately going to provide at least some kind of care for most Pennsylvanians. And we need that. Plus, we can be trendsetters again in Pennsylvania, and we can be the example and inspiration for the entire nation. Pennsylvania was the first state to cover their children with the CHIP program. And then other states followed. We were leaders. We were pioneers. Let's do that again, not just covering children, but covering everyone. So that people like Martha Weiss doesn't have to pay $50 copays on her medicine. So that if you need a medicine, your HMO, if you're lucky enough to have one, will not deny you that medicine because they don't want to pay for it because of the expense. You know, with regards to insurance companies, let me give you a little message, all right? I'm not thrilled with any reform bills on the state level yet, or on the federal level yet, because they give you too much leeway and control. But having said that, we still need to get these laws in place, my family and friends and viewers, because then we the people, the 300 million strong, can make Congress strengthen these bills, and hopefully by then strengthen these laws and re-examine them. For the insurance companies, let me make this 100% clear to you. I am tired of you discriminating against people with pre-existing conditions. I am tired of you denying people medical procedures because you don't want to pay for it. I am tired of you denying people certain medications because you feel they can get an alternative medicine. Well, maybe that alternative medicine doesn't really help the person, and in reality, it's a waste of time for the person to take it. You know what, insurance companies? You have made hundreds upon hundreds of millions of dollars. It's our turn now. And the United States Congress and the Pennsylvania state legislature or Congress, you need to start working for the American public. But the American public and Pittsburghers, we need you to work. I know it's annoying when I tell you to go to www.senate.gov, www.house.gov, or call your state legislators. I know you're not necessarily somebody that's ever done that before. But just because you've never done it before doesn't mean you can't start now. And maybe you don't have access to the internet. Use a phone. But the bottom line is lives are being lost and lives are being affected because we don't do anything. Because we do have that, oh, it's not my problem feeling. You think I'm out here in the chilly weather on September 11, 2009, because I enjoy being on TV? Or do you think I do this because of my ego? Believe me, I'm not that vain. That's not why I do it. I do it for the betterment of humanity. And because at night, whether you think about these things during the day, at night, I know and you know, there are times when you're saying to yourself, you know that Torcaso is a pain in the butt. But he's right. He says the truth that people won't hear anywhere else. And here's the other thing. Right now, you may not be affected by lack of health care. But I guarantee you, you know somebody who is. I also make this guarantee. Someday in your life, you will be affected if you don't have great medical care. You may be healthy now. You may even be 75 and never had to take any medicine. One day, most likely, you will, or another family member will. So this is not just about today, September the 11th, 2009. This is not just about 10 years from now, September the 11th, 2019. We need to make these changes now to affect people's lives from now, September the 11th, 2009, to the year 2211. What we do today can affect the future hundreds to maybe thousands of years into the future. We have that possibility. You can do it. And you may not think you have that power. You may not think you matter that much. You may not see yourself as a pioneer or a hero. But you can be. If I can do this in the chilly weather, if Annette can be willing to do this, if I can put my behind on the line, taking on billion-dollar corporations and letting them know what the reality is, or letting Congress know they're not serving the people. If I can take these major private and personal risks and possibly career-ending risks, you need to ask yourself, why would a person take such a risk? And it's a very simple answer, my friends. It's because when I say humanity really does matter, I mean it. It does. You do, your parents do, your great-grandchildren do. And this is America, land of the free, home of the brave. One of the most creative and innovative countries in the history of humanity. If we can put people on the moon and we can explore other planets, we can ensure every American. And I thought the president's speech was pretty darn good. But I had things where I disagreed with. I don't believe that the public option is only one part of the health care bill. I don't believe it's only one area. I think it is needed. And I think you need to support it and go to www.senate.gov, www.house.gov, and go to www.whitehouse.gov. Let your senators and the president and the representatives know you want that public option in there. $3 trillion on wars in Iraq and Afghanistan. We always have money to kill people. Well, it's time we have money to heal people, but let me tell you something. It's time that you don't have to worry about $50 deductibles. It's time that you don't have to worry about if your child, God forbid, should come down with cancer or something, or you. You shouldn't have to worry about, am I going to be able to afford the treatment? And you shouldn't be shortchanged on the treatment. And you shouldn't die as a result of not being able to get some of the best treatment. But there's the other reason. Don't you pay taxes every day? Don't Social Security and all those